Hi, my name is Amber, and I would much rather be in the classroom there with you today, but unfortunately, because of COVID, I am at home. But I want to talk to you about something that's really important to me. So, I look like this, and I'm wearing a very special necklace. This necklace is purple, which stands for dental hygiene. Do you know what that means? Well, I look like this sometimes, but other times, or you might see me like this. I am dressed in scrubs now. All right, so today we are going to learn about how to take good care of our teeth. Ready to learn? Here's the things we need to know. First, we're going to brush our teeth 2 times a day, morning and night. Second of all, we're going to floss 1 time a day, right? All right. Then we're gonna rinse with some mouthwash. It could be fluoride or it could be the mouthwash that has xylitol. And we're going to chew healthy things, sugar-free gums, candies, and if we have things with sugar, what do we need to do? Brush and floss, that's right. That is how we are going to have a healthy mouth. So as a dental hygienist, I clean teeth. I care for your teeth and I help you learn how to take care of your teeth. We like teeth. Can you see these beautiful teeth? How do we keep our teeth looking nice? Well, I'll give you a hint. Looks like this, or look. I've got a variety of toothbrushes. Can you see all of those toothbrushes? You probably can see them better on the screen than you would if I was here in person, huh? So, when we have a toothbrush, we need to clean our teeth in the morning and at night. And if you get a chance, the middle of the day would be great too. All right, so now it's time to brush. So you're gonna take your toothbrush and you're gonna take your teeth and you're gonna take your toothbrush angled at the gums. So not straight, but see how we're turning it? So it's angled towards the gums and on the tooth. And you're gonna brush and count to 3 on every tooth surface. So we're gonna count 1, 2, 3 here, 1, 2, 3 here. And when we do it, we actually have to count slow enough to make sure that we clean it really good. So let's try it. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. Get the idea? So we're gonna finish counting to 3. We're gonna go fast forward all the way to this side. Then we need to open up our mouth and we need to clean this part. This is called the occlusal surface, or the biting part. This is where all the food gets stuck in those grooves. So now we need to clean them really good, counting to 3. 1, 2, 3. Next one. 1, 2, 3. And we're gonna continue on over and all the way over to here. Then we're gonna come on the inside. Part is up on the inside of your mouth. Kind of tickles sometimes too, huh? So we're gonna count to 3. 1, 2, 3. 1, 2, 3. And we're gonna go all the way around to the other side, counting to 3 on every tooth. Then our top teeth should be pretty clean. Then we'll come to the bottom and we'll do the same thing, counting to 3 all across the front of the teeth, on the tops of the teeth, the biting part, and then on the inside. Now, in a real mouth, we have a tongue in there, right? Well, our tongue also needs to be cleaned. So the easiest way to clean your tongue is to open up and see if I can do this. We'll have to make his mouth halfway. You're gonna take your toothbrush on the back and brush your tongue towards the front like that. And sometimes I think it's easier if you lean over the sink, stick your tongue out and brush it down into the sink. All right, the next part is flossing. I have 2 different types of floss to show you today. One is the string floss. Grab it, pull it out, and break it off. Now with string floss, you want to have a piece big enough that you're able to wrap it around your finger, the second finger, the one next to our pointer finger. And I'm wrapping it around, And you want to have it long enough so when you wrap it, it'll stay on your fingers. This floss is kind of slippery, so once you get it on there, then you gotta pinch it with your 2 fingers like this. See that? So we have it on our hand and we're gonna pinch it. Then you can use your fingers to move it into your mouth. Now, we're gonna have to show you that on the model in just a moment. But the next part, or the other type of floss, is a flosser. I think these are really great and you can buy them at the dollar store, so even better, right? So you're gonna take your flosser and you're gonna go down between the teeth. Can you see that? Let's see if I can figure out how to get this better on the screen for you. We'll do a top one. Okay, so you're gonna push it between the teeth, and you hear that little snap? So it goes between the teeth, and then I'm gonna push it towards this back tooth and then towards this front tooth. Hope this works all right. So we're gonna push it in and we're gonna go up and down a few times along the surface of that tooth. Then we're gonna come over here and get this side. Why is this important? That's right, because when we were brushing, we brushed the outside, the top part where we chew, and the inside, but we didn't brush between the teeth. That's where all the bacteria are hiding. So we need to use floss to clean in between our teeth. It also removes some food that might have got stuck there. Who's ever had popcorn stuck between their teeth? Me. All right, so you're gonna floss every single tooth, and this should take you about a minute, maybe 2 minutes. The more you do it, the better you'll be. How long should we floss? Well, we should floss every tooth, but we should floss at least 1 time a day. I think the nighttime is the best because then when you go to sleep, your teeth should be sparkling clean if you brushed them really good and flossed them. One other thing you can do too is use fluoride. Have any of you ever put fluoride on your teeth? All right, so fluoride, I went and grabbed some of my fluoride. This one is ACT bubblegum fluoride. My son really likes the grape. There's a lot of different flavors. But one other product is called Spry, and it is a mouthwash, or it's a gum, or it's a toothpaste. So there are different products out there that are really good for your teeth. So brushing, flossing, and other products. So sometimes our teeth are shaped a little bit differently and we need extra help to clean them really good in between. So here's an example. So if this is the front of the teeth and this is the inside and this is the top part, I want you to see how this is the floss going down in between the teeth, but see how it doesn't touch right here? So there are special brushes that go in between the teeth. All right, are you ready to see what things are good for our teeth to eat? Carrots are good. Our toothbrush is good to use on our teeth. Apples are good to eat. What about cupcakes? Well, they taste good, but they're not really good for our teeth. They have sugar on them. This is soda pop. Soda pop good for our teeth? No. What about ice cream? I love ice cream, but it's not very good for my teeth. Toothpaste. We haven't talked about toothpaste. Is toothpaste good to use on our teeth? Yes. Candy? No. Bananas? Yes. Cookies? No. Does that mean though that we can never eat cookies or candy or soda pop or my favorite ice cream? No. What that means is we have to be good at brushing and flossing our teeth when we're done eating those things so that we can clean that off of our teeth. Otherwise, if we leave it on our teeth, it feeds those bacteria. And the bacteria that are on our teeth, they're not really nice. Those bacteria like to eat the food, and just like us, after we eat something, it has to come out. And that stuff that comes out is what actually is really harmful on our teeth. That's what can cause cavities, which is a hole in the tooth surface. It can cause bad breath. Oh, nobody likes bad breath. It can cause a lot of problems. So we don't like the bacteria in our mouth. So we have to keep the food out so that we don't keep feeding those bacteria and helping them to make bad things happen in our mouth, right? Right. Have you ever wondered what the bacteria look like that are inside of your mouth? Those are the bacteria that live inside your mouth. Now, Remember, they like to eat sugary things, and they love it when you don't brush your teeth. So we don't want them to be happy in our mouth, so we need to brush, floss, use mouthwash, and eat healthy things. All right, so now we're gonna have a quiz and see, can you point to the healthy tooth? I hope that you're pointing to this one. This one has really clean surfaces and it has healthy, tight pink gums. But look at this tooth. This one, the gums are really red and they are very sad. And when you bump them, sometimes they'll bleed. And then if that doesn't get taken care of, because we didn't brush and floss, down the road, years from now, it can turn into this, where that bone disappeared and the gums are still really red and inflamed. And can you see all this on the tooth? That's the tartar that I showed you on the bottom teeth on the model. So our goal is to have healthy teeth like this. And we keep them healthy by brushing those surfaces and keeping them really clean. And that's right, we also have to use our floss. And we'll take our floss and clean these surfaces. The next thing I want to tell you about is called sealants. This is a little tooth, a clear tooth. And can you see the top here where I've got those white grooves filled in with a material? So I showed you on our model here that the top of the teeth have really deep grooves, and food and bacteria slide down into those deep grooves. And sometimes it's really hard for our toothbrush to get all the way down to the bottom of those grooves. So we take a special material called sealant material and we just put that right down in the grooves there, and then we shine a light on it, and that light makes it so that it's hard and it doesn't come out. And you can eat and it stays in there and it helps you to keep your teeth a lot cleaner. So sealants are a really good thing, and they go on our back molars, the big teeth. All right, and one more thing I want to talk to you about today. Masks. We are wearing masks now because of COVID. And although masks are really good at helping us to not share COVID, masks actually are causing problems inside of our mouths. So the problem with masks is that when our mask is on, we feel like sometimes it's harder to breathe, so we breathe through our mouth like this, instead of just through our nose like this. So when we're breathing just through our mouth and we have our mask on, it actually dries out our mouth. Now, if you think about this, if you've ever been on a slippery slide at the water park and you're going down in the water and it just pushes you down, it's really fun and slippery, right? Well, that's what the bacteria think too. And then all of a sudden the water disappears and the bacteria kind of start sticking to everything. They can't slide fast anymore and they get stuck. Well, when that bacteria gets stuck, that's when it starts causing more problems too. So we really need to keep our mouth moist, which means we need to drink water, try and breathe through our noses, but keep our masks on because we want to be safe and overcome this COVID. All right, so who's ready to go to the dentist? I'm going to show you one more thing. You might see some cool glasses like this when you go to the dentist. We have magnifying glasses to help us see your teeth better, and a bright light. Ready? Pretty fun. Goodbye. See you at the dentist.